Welcome to my course about Nevada revised statutes or laws around cultural competency. My name is Jay Cafferata, and I will be your host today. A little bit about me. I hold a master's degree in communications and an associate's degree in deaf studies. I am also a certified diversity executive. I teach cultural competency courses for healthcare as well as professional development. I've been involved in the legislative processes that have created these laws and personally testified on these bills while they were being created during the 82nd and earlier sessions of the Nevada legislature. To be clear, I am not a lawyer or a legal analyst. I teach cultural competency courses for healthcare and professional development nationally, and these laws pertain to Nevada only. Other states may have similar laws, but the ones I'm discussing here are Nevada specific. Please check with your administrator, supervisor, or licensing board as to the application of these laws for you and how they might impact you. Again, I am not a lawyer, and my interpretation may be different from your licensing board or from the Department of Health and Human Services. But let's go ahead and get started. First of all, let's look at the currently published Nevada Revised Statutes, or NRS, cultural competency laws. Now, this is as of March of 2023. In Nevada, we have a legislative session that goes every other year, and so sometimes it takes a while for the laws to actually become published or updated from the prior session. So these are the laws that were passed in the 2021 session and not the 2023 session. And again, these are all just different versions of cultural competency and the different places that they are found in Nevada revised statutes or the laws in Nevada. You can see at the very top here, we have NRS Chapter 449, which is about medical facilities and other related entities. Chapter 62B, which is about general administration, etc. So again, some of these may apply to you and some of them may not, but these are the ones that actually are related to cultural competency in Nevada. Now, when we pass a law in Nevada, it goes through a regular process. And in order for it to actually become a law, it has to be considered enrolled. So if you go to the Nevada legislative webpage, you'll find that there are all these laws and bills that were created, but in order for it to be signed by the governor and actually become a law, it has to go through this process. So again, you can look at the Nevada legislature website for more information about these different sessions. Some of these laws were updated in the most recent session, and some were updated in the 2021 or even the 2019 session. All of the new legislation, of course, must be introduced, heard, and passed by both the Senate and the Assembly before heading to the governor's desk. And if a bill makes it to the governor to be signed, it is considered enrolled, and if the governor signs it, it becomes the law, effective on each bill's particular date of enforcement. Some of these, again, are impacted by new laws, some are impacted by amendments, and some are not. But again, you're going to look at the specific section that pertains to you. So in this last legislative session in 2023, these were the proposed laws that impacted either healthcare or cultural competency. And each of these, again, impact different laws and in different areas. So in the Assembly side, again, laws start either on the Assembly side or the Senate side, and then they have to be passed through each house, and then they have to be reconciled, which means that both sides have to agree on what is contained in that law. You'll notice that there are some here that have an asterisk by them and they failed to advance. And what that means is they did not meet the legislative deadlines to continue in the legislative process. So that means it didn't become a law or it didn't change the existing law. And some of these new amendments or laws, of course, do not impact healthcare professionals. But let's start by looking at each bill, beginning with the Assembly bills. Now, again, you can look at the asterisks and you can see that these are the ones that didn't make it. So, Assembly bills. Our Assembly bills started in the Assembly and then they go through the committee process and then get passed through and heard, and there are hearings and those kinds of things. So the first one that was on the list was AB, which stands for Assembly Bill number 266. And this is about governmental administration and the governing body that regulates counties and cities. And this is about languages and language access plans. And this does require that there is training for language access plans. Now, specifically, it lists any resources made available to employees of the county or city related to cultural competency. So it's requiring government agencies to provide cultural competency training for their employees and staff around language access. And that has to do with people who are not using English as their first language. The next bill we're going to look at was about anesthesiologist assistants, or AB 270. And this is actually a new type of medical provider in Nevada and its licensure. Now, even though it's a new designation, a new type of medical provider, it still includes cultural competency training as part of their licensing and their renewal of their license process. The next one we're going to look at is AB 364, which is about the Board of Medical Examiners. Now, the Board of Medical Examiners are the ones who license doctors and many other types of medical providers. And this actually has to do with expanding their membership of the board to include more types of providers to have a more balanced review of how they approve licenses and their regulations. AB 403 is about halfway houses. Now, in Nevada law, it used to be called a halfway house for persons recovering from alcohol or other substance abuse disorders. That has now been changed with this bill to say that they are now called recovery houses instead of a halfway house. Again, a recovery house for persons recovering from alcohol or other substance use disorders. So again, this is how the law is written, and it just changes that label. It also removes this type of facility from the list of licensed healthcare facilities under the licensing statute of 449. So this one doesn't really apply to cultural competency training any longer. In AB 428, this is about multicultural education, and it impacts teachers and the standards for professional development training. So things about intercultural or multicultural education in schools. And of course, it doesn't really impact cultural competency for healthcare providers. In AB 516, we used to have a department, which is called the Bureau of Indian Affairs here in Nevada. And this is actually a way to change the law about wording, again, changing language, and it's going to now be called the Department of Native American Affairs, because again, when we use the word Indian, it's a pejorative term. So the next one we're going to look at is AB 267, which actually changes 7 different NRS statutes or laws. So let's start with what AB 267 says. Now, this is the legislative digest or description of the bill and what it does. This is the law that impacts several other sections of the law or statutes governing different healthcare professionals. And we're going to go through each section, starting with the changes to NRS 449. Now, again, all these numbers kind of can become confusing. So to be clear, NRS 449 is about licensed healthcare facilities. And there are 26 types, well, now only 25 because we've removed one, as you can see the strike through. This is the different types of facilities that are licensed in the state of Nevada to provide healthcare. And if you were unaware of some of these, it's not surprising because you may not think of them as being a licensed healthcare facility, like a nursing pool or a facility for care of adults during the day, sometimes called adult daycare, or even businesses that provide referrals to residential facilities for groups. So again, these are the different types that are required to provide cultural competency training to their staff and employees and anyone who works in those facilities. If you work in one of these facilities, you are required to take a state-approved cultural competency course. So when we look at this specifically, this is referring to NRS 449.103, which is the chapter requiring training relating specifically to cultural competency for any agent or employee of the facility. So there's 2 parts of this. One of them is to enable an agent or employee to become aware of and how to treat effectively patients or residents that are in these facilities, to treat them with dignity and respect. And number 2, the training relating specifically to cultural competency is required and must be provided through a course or program that is approved by the Department of Health and Human Services. Now, again, first one is who, the second one is what. Now, this is how it reads before this new law, AB 267, becomes in force or enacted, which is January 1st of 2024. So AB 267 is going to change some of these parameters. So again, currently, this is the way that the law reads right now. And so these are the topics that must be covered in a cultural competency training from various racial and ethnic backgrounds. These are populations or people or patients or clients from religious backgrounds, various sexual orientations, gender identities or expressions, children and senior citizens, persons with mental and physical disabilities, and part of any other population that such an agent or employee may need to better understand as determined by the board. Now, the board that we're talking about here is the State Board of Health, and any other population that might be determined by the board to be important is if you are a facility that has a 60, 70, 80% population that you serve as one particular group, then that might be a group that you would really need to understand better to provide the best care. So, for example, in Southern Nevada, we have a very large population of folks that come from Nigeria. So it might be really helpful for you to understand that the official language of Nigeria is English. Again, these are just basic ideas or facts about a population that comes from Nigeria that you need to understand in order to treat them the best with dignity, respect, all of those kinds of things, and to sort of offset any preconceived notions or biases that you might have from people who are from Nigeria. Now, there's another law that also has to do with this, and that is any of the mental health or nurses that are also required to have cultural competency training. And there's actually several different types of providers that we're going to look at next. But this is the difference. So in every other medical provider, it says you may use the training that's already provided according to NRS 449.103, which is the one we just looked at. But now they're going to change the topics or the groups of the populations to include these populations. So persons from various gender, racial, and ethnic backgrounds, persons from various religious backgrounds, LGBT or questioning persons, children and senior citizens, persons with a mental illness, persons with intellectual, developmental, or physical disability, veterans, and persons who are part of any other population. Now, again, these are sort of the same kinds of things, but again, both of them must be approved by either the licensing board or the Department of Health and Human Services. So again, these are the different parameters or topics that must be included. So who's impacted by these laws? So AB 267 specifically addresses these particular types of providers. And what 267 does is it doesn't change the topics or the populations, but it changes the numbers of hours that are required to renew your license as a professional. So this includes these statutes: NRS 632, which is nursing and mental health professionals, 641, which is psychologists, 641A, marriage and family therapists and professional counselors, 641B, social workers, 641C, alcohol, drug, and gambling counselors, and 641D, applied behavior analysts. Now, as you can see here, some of these are from the current law, which says from 2 hours of continuing education about cultural competency. So for nurses, it's going to go from 2 hours to 4 hours. For psychologists, it's 2 hours to 6 hours. Marriage and family therapists, 2 to 6. And again, social workers and applied behavior analysts go from 2 hours requirement to a 6 hour requirement. The one that's significantly different is alcohol, drug, and gambling counselors. And currently, they are required to have 1 hour for every year of the term of their application for their license. And their licenses are run on a different time schedule than biennially, which is every other year. So that means that they have to have 3 hours for every year of the term of their application or their license. So if you are an alcohol, drug, or gambling counselor, you might need to check with your board to find out what kinds of courses are going to actually meet these requirements. Again, though, any of these providers can use the course that is approved in NRS 449.103. Now, There are some other chapters that require cultural competency training, but they are not changed in AB 267. And they are NRS 630, which is physicians, physician assistants, medical assistants, perfusionists, and practitioners of respiratory care in public health and juvenile detention. Now, if you remember back to that first slide where I was talking about all the different NRS chapters that are impacted by cultural competency, that's where things like juvenile detention and public health come in. But let's again focus on AB 267, most of which of the changes are simple changes to the number of required hours to renew a professional license. I am going to separate NRS 449.103 because it has a lot more changes. So again, these are the ones that are just the change in the required number of hours. But now we're going to look at what changes in 449.103. So one of the first changes is that the board, the State Board of Health again, is going to set by regulation the frequency with which a medical facility, a facility for the dependent, or other facility is required to provide such training. Now, again, the facility is required to provide this training, not the provider. So if you work in a facility that is under these laws, then the facility must provide this training to you. So the changes that will be set by regulation are forthcoming from DHHS, or the Department of Health and Human Services. They must go through a process that invites public opinion and comments, checks to ensure constitutionality, among others, before finalizing and being passed by the State Board of Health. The Department of Health and Human Services creates and follows the process, but the board listed here is the State Board of Health, and that's the one who actually approves the regulations and then allows them to be in force. Now, the next change is about this. Except as otherwise provided in Section 3, the requirements are to determine who is going to be covered by NRS 449.103. And that is anyone who provides clinical, administrative, or support services and has direct patient contact at least once a week on average, and two, oversees an agent or employee described in paragraph 1. So that's again, this is just sort of like if you provide this care or if you oversee someone who does. That's a change. It used to be anyone in a medical facility. So they're specifying who actually has to have this training. And number two, this is to say that if you work in a facility, but you also have a professional license, then you don't have to take the course twice to make sure that you are meeting your continuing education requirements for your license and the facility. If you have met the requirements for your professional license, then a facility can accept that certification as good enough for the facility's licensing. Because again, the facility holds the license that is going to be checked to make sure that everyone in their facility has met the standard of compliance of cultural competency training. Now, the next big change is that it used to be that only Department of Health and Human Services had a list of the providers that offered this training. And there's two different ways that you can actually provide this training as a facility. You can either have an internal version or you can use the third-party provider. So now it is going to be the responsibility of the Office of Minority Health and Equity, which is part of the Department of Health and Human Services, to establish and maintain that list of courses and programs and make sure that the current list is available on their internet website and ensure that the list is established and maintained to make sure that every medical facility has access to that list and is distributed to them. Also, medical facilities are required to conduct training specifically related to this. But again, it has to have an approved course. You can apply to have your own course internally, but that course still has to be approved. Now, this is a change in that the department must approve or deny that application within 10 business days of receipt of the application. And in the past, it was up to 6 months. So this is a significant change in terms of how the department is going to be approving courses. In the past, the department would either say yes or no, and if it said no to the approval, then it would give the facility insight into the things that needed to be corrected. With a shorter deadline of 10 business days, it is unlikely that the department will be able to offer that kind of guidance to facilities that are providing or submitting their own course. They're most likely going to just get a, this is not appropriate or not good enough, and you're going to have to start over, but there will be no insight into what needs to be changed. That is my idea. I'm not sure that the Department of Health and Human Services is going to actually do that, but it just makes sense that if they are receiving 100 submissions in a day, then they're not really going to have time to actually go through that and write, any kind of analysis for the facility to make corrections. It will be upon the facility to just understand that they need to start over or do things better in order to make something that meets the guidelines. Now, the other change is that there will be a reporting required that goes back to the legislature. And this didn't happen before. So on every year, they're going to have to submit this report that says how long it takes for a course to become approved. And the next thing is they're creating these definitions. So what direct patient contact means, and it also means in terms of anyone who's using telephone, electronic mail, email, telehealth, or other electronic means. It doesn't mean incidental contact or contact, I'm sorry. So again, another piece of information that's really important to AB 267 is when. And what at the bottom of every piece of legislation that is enrolled, there is a date when it will become in force. And so in this particular case, as of January 1 of 2024, AB 267 will go into effect. So now we're going to look at the next set of bills, which came from the Senate. Again, just to be clear, when we talk about passage and approval for the purpose of adopting any regulations, that is talking about the regulatory process. That's the development of those regulations. Now, the State Board of Health meets quarterly, and the regulations must be approved before they can be enforced. That being said, licensing boards, right, which is the other piece of this, each has their own mechanism for approving courses that are approved for licensing or for professional licenses. So each board will have their own process for how they're going to create and enforce these regulations. So now we're going to look at the Senate bills, and far fewer of them actually survive through the legislative process. So this is a little bit quicker. So again, these ones are sort of different. This one is about corrections, and this is about a law that is going to create facility training that includes interacting with offenders who are transgender, gender nonconforming, gender non-binary, and intersex, and providing other matters properly relating to. This is, again, the digest. The director of the Department of Corrections is going to be the one who approves these regulations, but the content is specifically set in the law. So they don't have a lot of wiggle room about what must be included. They do have the regulations, which is how they're going to actually perform these kinds of trainings, but the training itself and the topics are not up for discussion. The next one is SB 439, which is HIV modernization bill, and it is going to change a few providers' requirements for continuing education. So the first group that's listed in SB 439 is under NRS 632, which is about nursing and mental health professionals. And again, this is about changing training requirements. So now, as of January 1st, 2024, all nurses and anyone who is covered under NRS 632 will have to have at least 2 hours of training in the stigma, discrimination, and unrecognized bias towards persons who have acquired or at high risk of acquiring HIV. And it has to be completed within 2 years after beginning to provide or supervise the provision of such services or care. So again, this is something that is going to be added that's different from AB 267, but it's a new piece of cultural competency training for nurses. Another group that's going to be impacted are physician assistants and anyone who's supervising physician's assistants. And this is NRS 633. Same kinds of things, that you will still have to maintain your cultural competency, but now you're going to have an additional 2 hours minimum, a minimum of 2 hours in training around the stigma, discrimination, and unrecognized bias towards people who have acquired or at a high risk of acquiring HIV. So, in summary, each of these bills impact healthcare professionals in different ways. And these new laws will not be posted on the Legislative Council Bureau webpage or the NRS page for some time because, again, it takes a while for these things to go through the process. And that's why it's important to stay on top of these changes that happen in the session, during the session, and not necessarily wait for the listing for the licensing board or the Department of Health and Human Services to inform you of the changes because the law will be in effect. So again, some of these are going to impact the same professional like nurses and physician assistants, creating multiple changes within their one section of the law. All of them are tied to professional licenses or facility licenses, and enforcement is through the licensing boards, the Department of Health and Human Services, or the Department of Corrections. And just to remind you that all of these pieces of legislation are intended to protect patients and direct patient care. And as healthcare professionals, we need to make sure that we are protecting our patients and understanding why these laws have been passed and how they are intended to be implemented, sometimes called legislative intent. And that's again where we go back to this is here to protect patients and direct patient care. So I'd like to say thank you for watching this brief video about NRS 449 and AB 267 and all the other laws that were passed or amended in the 82nd session or the 2023 session of the Nevada legislature. Again, these are all specific to the state of Nevada. There are other states that have other laws that may be similar, but this is all about Nevada. Please subscribe and like this video if you would like to see more content about Nevada and cultural competency. Again, just a reminder to please check with your licensing board or the Department of Health and Human Services or Corrections to determine how these laws apply to you. For additional information, please don't hesitate to reach out to me. You can find me through my website at www.asltraining.com. The HIV stigma course will be available on my website at asltraining.com in the next week or two. And then again, it will be made available through the licensing boards as determined by the law. So thank you again. Appreciate your time. Have a great day.